Thank you very much. Thanks, Lee, and thank you very much to TBA for having me here this afternoon. So now that I've had a promotion at Rossdale's to a partner, that was a very good development for my afternoon off work. I'm going to just talk you through a bit of an update on the project that's been sponsored by the TBA and the HBLB. So it would only be right for me to start by acknowledging the fact that this is very much not been a single-handed venture, and there is a huge number of people who've contributed to this project that we've undertaken. People are listed on this slide here. Obviously, a huge thank you to the TBA who funded this project through the HBLB Small Project Grant, and obviously without them it wouldn't have been possible. Also a big thank you to NEH, specifically some of their vets and clients. Sally Bainton and David Dugdale have been very helpful in helping us get this project completed. Obviously a large number of vets at Rossdale's and all the laboratory staff at Rossdale's have been very important. And then on the right there we have a list of local stud farms who've all volunteered to be involved in this project, and I appreciate it's been a huge amount of work, and especially as these foals got older, bringing them in from the paddock to be sampled. So an enormous thank you to everybody who's been involved in this project. So before we start though, I just want to go through a bit of background, because I appreciate that probably this is a disease that some people know more about than others. So Lawsonia intracellularis is a cause of a disease called equine proliferative enteropathy. It's basically the equine form of a disease which is very common in the pig industry called porcine proliferative enteropathy. It is fundamentally a bacterial disease of the intestinal tract that affects weanlings predominantly, but also foals, older animals, so yearlings, and very, very occasionally has been reported to cause disease in adult horses. So what happens with this disease? It's a bacterial infection, like I said. The bacteria get ingested orally, so they get eaten from when the horse is grazing. These bacteria migrate to the cells that line the inside of the small intestine, and what they do is they cause inflammation and thickening of the lining of the small intestine. That does a number of things in terms of what happens to the actual foal. The gut becomes effectively leaky, and that can cause signs of illness in the foal, but it also massively reduces the ability of the foal to absorb nutrients through the gut. So this picture here on the left is a picture of a foal intestine that's got obviously quite severe Lawsonia. You can appreciate that the wall itself is quite thick, and all this knobbly looking appearance is where the lining of the small intestine is very inflamed. If we look at that at a cellular level, again this is just a close-up to show you that this bacteria actually gets right into the cells that line the lining of the small intestine. So the next thing we obviously want to know is where the infection comes from. Our current understanding at the moment is that this bacteria usually comes from a reservoir of wildlife being the source of infection. And there are many species of wildlife that have been shown worldwide to be able to carry this bacteria in their feces. When we think about the animals that we have in the UK, these animals I put on the left are probably some of our main culprits, not to say exclusively, and I don't want you to go home and all start shooting all the wildlife on your farms, but these are the sorts of animals that we're probably looking at that have the ability to carry this bacteria in their feces. And what that does is it acts as a reservoir for infection, which means that the bacteria is present on our farms and in the area, a large proportion of the time. What we also recognise over the last few years is that infected foals also probably have some role in the transmission of this disease. And so when foals are ill and when foals are affected with the problem, they will then shed the bacteria in their feces, and that can maybe amplify the disease risk for other foals in the same paddock. Just something I think is important for us to say in terms of the similarity between this disease and the pig form of the disease. Although the disease is very similar, the bacteria is very similar, when the strains have been typed out and they've looked in more detail about which strains that affect pigs and which strains affect horses, I think it's important to say that the strain that affects horses is quite different in a number of places to the pig strain. And actually, the vast majority of cases of Lawsonia that we see are not related to the pig strain of the disease, and I think that's important for us to remember. Obviously, that's not the whole story. We know this is quite a sporadic disease, and so what we know too is that the immune response is very important in terms of the individual animal's susceptibility to disease. And that makes it a bit similar to rhodococcus in as much as that, we know that many foals are exposed to rhodococcus, but actually only a small percentage of them get the clinical disease. So this is really important in terms of why some foals get the disease and some don't. There's still obviously a lot of work that we need to do in this area, but the things that we recognise that are probably playing a role, we suspect that there may be some some protection provided by colostral antibodies, so the antibodies that the foals get from the mare. But they're also actually the foal's ability to mount what we call a cell-mediated immune response, so the part of their immune system which can actually target cells that get, bacteria that get inside the cells. What we also recognise as part of this is that the foals become most at risk for this disease when their antibody levels are declining from the mare and when their own immune system is maturing, and that definitely gives us this window of higher risk. We've also recognised that milk probably has a protective effect, so that the actual local effect of milk on the gut may help stimulate a local immune response which is protective. And for all these reasons, it makes sense to us that weaning is actually a high-risk time for this disease, because in addition to these factors about the immune system, these foals are usually under a lot of stress. They've had social change, they have had dietary change, and so this really is a high-risk time for these foals. So when we talk about recognition of this disease, these are the main clinical signs that we see. Sometimes we'll just see mild general lethargy or malaise, mild fever, slight depression, inappetence. Edema, so which means swelling of the throat and the legs and belly, that's quite a common sign, and that's quite pathognomonic for this disease. What we'll appreciate is swelling up in this area here, sometimes in the lower leg. The signs of colic and diarrhea are a bit more variable. Sometimes that's the first sign we see, sometimes we don't appreciate those signs at all. And some of the most important signs in terms of producing performance animals is that we often associate this disease with lots of loss of condition and weight loss. So this is a prime example of the sort of foal that we see that's been affected by the disease. You can see this foal's overall just not in great condition, the hair coat's a bit rough. If you look closely at this foal, I don't know how well it projects, you can see this foal has swelling up in the throat latch, has swelling up in its boobs down here, the lower legs are a bit filled. And these are some of the classic signs to look out for when we're thinking about trying to recognise this disease. In terms of diagnosis, how do we make a diagnosis of this condition? Well, there are a number of things that we can do, and it's actually important that we do usually a number of these together. Firstly, we look for a blood test to see that the blood protein level is low. Remember I said to you about the fact that the small intestine loses its ability to function normally. Through that, we see that the foal will usually lose protein across the gut wall, and so we'll recognise that the blood protein level is low. We can also detect the bacteria in the feces of these animals. It's very difficult to culture actually, so we have to use molecular testing, but we can use PCR, which is a type of molecular testing to pick up the bacteria. We also use blood tests to look for an increasing antibody level to the bacteria. We're going to talk a lot about that through the rest of this session. And when we do ultrasound on this foals too, we also appreciate that the wall of the small intestine is thickened, which is an important part of the disease process. How we treat these foals? Well, obviously it's a bacterial disease. We use antibiotics to kill the bacteria. These are the two main drugs that we use, either injectable oxytetracycline or oral Caradox. In addition to that, though, these foals usually need a bit more TLC. We'll often use gastroprotectants. Some of these foals will need more intense supportive care. Sometimes they'll need some intravenous protein substitutes or plasma. They need careful nutrition. And again, something that's important to us in terms of trying to produce animals for the sales, they often need quite a lot of time to recover. And sometimes that's the one thing that we're trying to avoid. The outlook for this disease is usually quite good. We find most of these foals will make a full recovery. It's definitely true that the earlier we detect the disease, the much better the prognosis and the much shorter the time of convalescence. Like I said, the convalescence can be quite prolonged. And there has been one study that's published that showed that even though the foals made a good recovery, they still made a reduced price at yearling sales the year after. And a small percentage die from complications. I put the 5% up there. I think if you have animals in that 5%, it probably feels like quite a lot. But as a general rule, the recovery rates are quite good, but there are a small percentage that get complications from this problem and do die from it. Prevention, this is an area that's obviously got a lot of attention over the last few years, and we talked about this last year. The things that we attempt to do, we try and reduce wildlife feed contamination. That's obviously quite difficult, but things like trying not to leave feed containers out in the paddocks. We are now trying to isolate ill foals, recognising that they do shed the bacteria, trying to put in some sort of monitoring or screening processes for our weanlings, and obviously the use of the pig vaccine that, again, a lot more people are trying out and are using. There is a reasonable amount of evidence to suggest that it has some role in preventing the disease. It is the pig vaccine that we use, and we think there's enough crossover between the strains that this can still give some protection, and that we give 2 doses of this vaccine intrarectally 1 month apart. But we still don't know that much about this vaccine, and that's one of the driving forces behind this study, that we don't know that much about how the vaccine works. We don't know that much about this disease in our own population. So that brings us on to this study that we've done over the last 12 months. This was the title of the study, the serial investigation of the seroprevalence and fecal shedding of Lawsonia intracellularis in thoroughbred foals in the first year of life. Very catchy, I think you'll agree. The thing that we're going to focus on a lot is this term seroprevalence. So I just put on here now what that actually means for those of you who don't know. And the seroprevalence simply means that it's the number of foals that have a high antibody level. So if you have once the blood test with an antibody level is positive, that you're considered seropositive. And that's a term that we're going to keep coming back to through the next few slides. This is the real background behind it, which I've sort of alluded to already, that although there's actually a reasonable number of reports about this disease in Kentucky and in the US, a little bit in Europe, there's actually been no UK-based data talking about this disease. And we don't really know what the background level of exposure is or the background level of infection rate is in this country. And that's actually really important for us because there are lots of geographical differences, seasonal differences, and so it is important that we sort of try and get hold of that information for our own population. And it's really important in terms of our ability to prevent and treat this disease that we have a better understanding of the epidemiology, the disease processes behind it. So we had 3 aims in this study. The first one was simply to determine the seroprevalence of Lawsonia in foals and their mares in this area. Secondly, what we wanted to see was what the timing of seroconversion was, so what was the time that most of these foals were being exposed to the bacteria, and also to determine how frequently foals were shedding the bacteria in their feces. So that was the things that we set out to try and look at. This is how we tried to do it. We aimed to enrol 50 foals from the 2014 foal crop from 6 local farms who kindly volunteered to be involved in the study. And that was a wide spectrum of people. There was, I'd just like to stress at this point, it wasn't that any of these farms had a particular problem with the disease. They were just keen to support this project going forward. We took blood and fecal samples from these foals at 0, 3, 6, 9 and 12 months of age, and just 1 single blood sample from the mare shortly after foaling. And at each of these time points we performed the royal we, this is I should say, a brief physical exam, and all the foals are monitored for signs of clinical disease. So in terms of the blood test, what we actually looked for, firstly and quite importantly, we did a general health profile, and that enabled us to look at the foals' protein levels and signs of inflammation or infection. We also did this antibody test to look for the presence of antibodies to Lawsonia. And the presence of antibodies, it's important to remember, we need it to tell us about exposure to the disease or infection, but you can't always distinguish between the two. And we also must remember that in the younger foals, the presence of antibodies may just reflect the fact that the foal got antibodies from the mare's colostrum. So when we're talking about how to interpret this test result, these are the options. Because it's an antibody test, you get what we call a titer, so it's a sort of categorical answer. When we have a titer that's less than 60, that means that we have a negative result, and anything 60 or above is basically considered positive. Obviously, the higher the number, the more positive the test result is, and that's important as we talk about the results that we go through. In terms of the fecal test, we did the molecular testing using a special assay that's been validated for use on feces to look for the presence of the bacteria, and this gives you a quantitative result in terms of telling you how much of the bacteria is present in the feces. And all these tests were performed at Beaufort Cottage Laboratories, which is part of Rossdale's lab. No one in this room cares at all about this, I'm sure, but we did do some statistical analysis to look at our data and try and get some sensible conclusions. So in terms of the results, we were nearly successful in enrolling 50 foals. We managed to enroll 47 foals in the study. Unfortunately, as is the nature of the industry, we didn't make it through to the end with all of those. 8 foals went to the sales. 2 foals unfortunately died for reasons unrelated to Lawsonia. In terms of the percentage of foals on each farm that were enrolled, it was between 20 to 100% of each foal crop on these farms that were enrolled in the study. And we did have a slight selection bias at the beginning in that we did try and select foals that we expected to stay on the farm for the duration of the year. So we did actively select for foals that we weren't expecting to go to the foal sales. Obviously, we weren't completely successful in this, but that was something that we did from the beginning to try and increase the number of foals that we'd be able to sample all the way through. And we sampled slightly more colts than fillies. So this is the results that we found. If we look at the mares' test results, what we found is that over 3/4 of the mares had a positive blood test. So again, we're in the same colour scheme as I showed you before. This green here is the negative, This is the positives. Again, the slightly lower positives, the more positives up here. And quite a significant proportion of these mares actually had a high antibody titer to this disease. When we then look at the foals, what we found is a very similar distribution of antibody levels, and slightly lower than the mares, but 64% of foals had a positive titer. And again, that same proportion of foals that had a very high titer, had a high test result. And we'll go on and discuss these a little bit more as we move on. And unsurprisingly, what we also found was that there's a significant association between a positive mare result and a positive foal result. And that obviously makes sense. We expect the mares that have produced the most antibodies at the time of foaling to then transfer those antibodies to the foal, and the foals to have a higher test result too. And we did see that the mares that had the highest test results also had the foals that had the highest test results. And the converse of that too, we didn't find any positive results in foals that have been born to mares without a positive test result, which makes sense from what we would have expected. We also looked at the IgG level of all the foals in this study. The median IgG was 9. There were 14 foals that had an IgG below 8. And we also found there was a strong association between the foals that didn't have a IgG over 8 and having a negative antibody test result. And again, that just, I think, highlighting the thing again, that actually the colostral transfer of these antibodies definitely happens. How important it is, we don't quite know, but that the foals that weren't getting adequate antibodies from the mare had negative test results. This graph is very confusing, and I just put it up there to show you the data overall. This is showing you that all the test results over the whole 12-month period for the foals. The percentages are on the left, the times are on the bottom. What I'm going to try and do is to separate this out for you to make it a little bit easier to understand. So this moving on, then this graph shows you now just the positive test results over time, and this is including the foals that had any sort of positive test result. So what we see in these foals is that we saw a very distinct trend, that we had a high percentage of foals that were positive, like I just showed you after the colostral transfer of antibodies from the mare. This dropped off by 3 months as those antibodies just disappeared, and that's what happens. The antibodies get used up and disappear over time. And that we saw that these foals then gradually became exposed to the bacteria, and we get this trend where we had an increasing percentage of foals that were producing antibodies to Lawsonia over time, with a peak at this 9-month period where we were having the greatest proportion of results that were positive. This is exactly the same graph, but just showing you the foals that just had a strong positive result. And I think it gives you exactly the same information, but just makes that trend a bit easier to see, that you can really see that the antibody levels drop off in most foals by 3 months, and then we're getting this increasing exposure, which seems to peak at about 9 months of age. This is just the same information, but in a slightly different way. I just wanted to say that results I've just showed you gives you all the positive test results at each time period. What we then did was then just looked at the first time point that the foals produced antibodies, because obviously those positive results can have a slightly cumulative nature, and what we actually want to know is what is the time point that the foals first produce antibodies to this bacteria. So what we found is actually that 78% of foals did produce antibodies to Lawsonia during the study period. Just 22% of them did not after their maternal antibodies had waned. And again, what we see is that we're seeing the majority of foals that are having the first evidence of exposure to the bacteria in this 6 to 9 month window, with a smaller percentage of foals still being exposed by the time they got to yearlings. We then tried to look at that data by month to see if that gave us any more clues. This again just gives you the percentage of positives by month. And again, what we'll see is that you can see that the times where we had peak number of positive test results was in December, with a slightly second peak again in April. Again, I just separated this out again too. I promise this is the last graph I'm going to show you. See that you're all probably struggling a little bit by now with this. But this is the last graph, and again, what I just wanted to show you again was, again, that first time point where the foals seroconverted. So obviously the test results become cumulative as the foals develop antibodies and they stay positive, but we found that the peak of foals were first producing antibodies in that December period, and actually by the time we got further out, the number of foals that were starting to show signs of exposure were really reducing. And again, there was still the same 22% of foals that did not seroconvert. So in terms of the other things that we measured, the blood test results, we compared all the blood tests between all the foals at different time points. There really wasn't a huge amount of difference in the majority of these things. The one significant finding that we did find was that the albumin concentration, so that's a part of the foal's protein concentration, was significantly lower in the foals that had a positive antibody result at 9 months of age versus the foals that were negative. We said already that 9-month period was the point where it seemed like the majority of foals were being exposed to the bacteria, and there was a slightly lower albumin concentration in these foals, and we'll come back to that again in a minute. In terms of reports of disease, we didn't have any clinical cases of Lawsonia through this study period, at least that we recognised. We had a variety of what we would consider normal sorts of disease processes through the period. We also had some objective reports of the foal's conditions, where the people on the farm were asked to record the body condition of the foals at each time. We did try and compare these between the different groups, but in all honesty, there probably wasn't enough foals that we considered to be in not excellent condition, which is good news for everybody involved. When we looked at the faeces samples, we tested 159 faecal samples altogether, and we found that only two samples were positive through that whole time period. And of the first positive was in one foal at 3 months of age. That foal had a negative antibody test result, making you suspect that may be just a sort of transitory thing. We just picked that up as that foal just had a low number of the bacteria present in the faeces. We also picked up one positive in a foal at 9 months of age, and that foal had a high antibody test result, which makes you suspect this foal maybe did have a subclinical infection. But the very vast majority of these faeces, we were not able to identify the bacteria in them. So in terms of discussion and conclusions that we make from this study, the findings that are obviously relevant to us are firstly that we have this very high rate of seroprevalence in mares, and that associated with that we have a high rate of colostral transfer of antibodies. So the mares are producing antibodies close to foaling, they're transferred in the colostrum to the foals. We need to know a bit more about how important this really is in terms of preventing disease, but it is important in terms of recognising this as what's happening in our population. In terms of these antibodies, we're also recognising that they are dropping off and disappearing by 3 to 6 months of age in most foals. That obviously may have a role in terms of the disease susceptibility of these animals, but it's also important for us to remember when we're interpreting blood test results that if we're looking at young foals, it's quite likely that they're still going to have a high test result simply from the antibodies they acquired from the mare. In terms of looking at the foal seroconversion, again, the amount of exposure to this bacteria was very high, so 78% of all foals in this population seroconverted to Lawsonia after the maternal antibodies were lost. And this is important to us. It tells us that we do have a really high rate of exposure to the bacteria. And foals on every single one of the farms involved seroconverted. And like I said, these are not farms where it's been that we've had a huge problem with Lawsonia. So, this is a condition that's out there, or at least a bacteria that's out there, and exposure in our population is very important and common. In terms of looking more specifically at the age of timing of seroconversion, we really recognise that peak time for seroconversion was in that 6 to 9 month window. But we did have some outliers that seroconverted younger to this and up to the age of yearlings. And although it's slightly beyond the scope of this study, I think that information is hopefully useful to us when we're going forward to think about vaccinating foals and the timing of vaccination. If we're better able to identify when the peak risk seems to be, then that will hopefully be useful for us in terms of developing our procedures. We also highlighted that December was a peak month of the year. I think we have to interpret this very cautiously because of the sampling frequency that we use. We sampled these foals at 3 months of age. We had a lot of foals that were 9 months old in December. So I think we probably need a bit more information to know if this is really true. But it is fair to say, I think, that the majority of foals seroconverted between September and January. In terms of clinical disease, well, it's encouraging to know that we didn't have any clinical disease during the study period. And it does highlight one of the difficulties of this disease. It's so sporadic in nature that we rarely have big outbreaks. We'll just have individual foals that get affected from season to season. I think that the finding that was interesting to us is that this significant difference in the protein concentrations in the positive foals in this 9 month A group does suggest that there may have been some subclinical disease that we didn't affect. And again, although we can't make these sorts of bold conclusions from this study, that may suggest that there is some role for this disease in terms of growth and performance, and that if there is subclinical affection, we don't really understand how much impact that has on these foals as their development. In terms of the faeces, well, we had obviously minimal faecal shedding through the study period. It suggests that actually the healthy foals don't have a major role in disease transmission, and it's also helpful when we're interpreting positive test results. I think we can all feel a lot more confident saying that when we have positive test results, they're more likely to be significant, because actually healthy foals very rarely shed the bacteria in their faeces. Obviously, there are some limitations to this study. It was only a small population of foals. We sampled them only at 3-month windows. We don't have all the data that we'd like to in terms of some of the clinical data. We would have liked to have body weights, but that data just wasn't available. And obviously, there's still a lot more things that we need to do in terms of identifying risk factors for clinical disease and the risk factors for seroconversion, and maybe look a bit more into the effects of subclinical disease on growth and development, and again, evaluate the efficacy of vaccination a bit more. But we feel like this study has been a good start, and we feel like we've got some useful information that hopefully will be helpful to you and that we can take forward from here. So again, a huge thank you to all those people who've been involved, because without them it really wouldn't have been possible. And that's it. Thank you very much.